looked at your beloved furry companion, especially as they're getting a little older, and noticed some subtle changes? Maybe they're drinking a bit more water than usual, or their belly seems, a little rounder, or maybe their fur just isn't quite as thick as it used to be. And it's so easy, isn't it, to just think, oh, well, they're just getting old.
Yeah.
But what if those seemingly, benign signs were actually pointing to something much more significant, something kind of hidden in plain sight? Today, we're diving deep into a condition that really is a master of disguise, often masquerading as normal aging. It's called Cushing's disease, or medically known as hyperadrenocorticism. This deep dive is basically your shortcut to understanding this pretty complex hormonal disorder. We're going to unpack what it is, why it happens, the specific signs you should watch for, how veterinarians actually play detective to diagnose it, and, of course, the available treatment options. Our mission here is really to equip you with crucial knowledge for your pet's well-being. Because at its heart, Cushing's is about the body producing way too much of a powerful hormone called cortisol. And that can have, impacts all over the body.
Right. And what's truly fascinating is just how vital cortisol normally is for a pet's body. It's a hormone that plays a crucial role in regulating their metabolism, keeping blood pressure healthy,
Right.
managing their immune response, and even helping them cope with stress. It's essentially their built-in stress hormone.
Yeah.
But if that delicate balance gets thrown off and the body produces way too much, well, the implications can be significant, affecting almost every system and ultimately their quality of life.
So that classic phrase, too much of a good thing, that seems to be the core issue here. But what does too much cortisol actually do inside a pet's body? What are the mechanisms behind these widespread effects you mentioned?
Yeah, that's where it gets complicated because cortisol is just so fundamental. When levels are chronically high, it starts to, break down muscle tissue, suppress the immune system. It constantly raises blood sugar. Essentially, it puts the body in a permanent state of fight or flight stress. And that just wears everything down over time. It's a chronic endocrine disorder, meaning it's a long-term hormonal imbalance. And if it's left unchecked, it really does significantly affect a pet's overall quality of life.
Okay, this is where it gets really interesting and maybe a bit daunting for owners, because Cushing's isn't just one single thing, right? It's almost like a family of conditions all leading to the same problem. So how do we even begin to untangle these different origins?
You've hit on the crucial point there. Understanding the specific cause is absolutely key because each pathway, it really does lead to a different treatment strategy. So there are three main types. The most common form, we see this in about 80–85% of cases in dogs, is pituitary-dependent hyperadrenocorticism, or PDH. Think of this as a kind of brain signal problem. There's a tiny tumor, usually benign, thankfully, that forms in the pituitary gland right at the base of the brain. This tumor acts like an overzealous conductor, basically. It signals the pituitary to secrete excessive amounts of ACTH, that's adrenocorticotropic hormone,
Right.
which then tells the adrenal glands, hey, make more cortisol. Then the second type, we have adrenal-dependent hypodrenocorticism, or ADH. This makes up about 15–20% of cases. Here, the problem starts directly in one of the adrenal glands themselves. A tumor forms right there.
Yeah.
And this adrenal tumor just starts pumping out cortisol independently, completely bypassing the pituitary gland's normal control signals.
Yeah.
Now, these adrenal tumors, they can be benign, as we call those adenomas, or unfortunately, they can be malignant, which are carcinomas.
Ah, okay.
And that distinction matters hugely, because a malignant tumor needs a much different, often more aggressive approach. And finally, there's a very important type to know about, iatrogenic Cushing's disease. This form is actually caused by us, in a way. It's induced by long-term or high-dose use of corticosteroid medications.
Like prednisone.
Exactly, like prednisone, which vets often prescribe for things like inflammation or allergies. These medications, they mimic the effects of natural cortisol. And if you use too much for too long, it can suppress the body's own natural hormone production, while at the same time causing all the classic symptoms of Cushing's. So it's like we've inadvertently given the condition by trying to treat something else.
Wow.
So yeah, figuring out which of these three it is, that's fundamental to treatment. Like solving a crime, identify the culprit, then you know how to catch them.
So it really hammers home that it's not just Cushing's, it's these three distinct paths leading to the same cortisol overload. And knowing if it's a brain signal issue, an adrenal gland issue, or a medication side effect, that sounds absolutely critical for deciding what to do next. Does it directly dictate the treatment?
Absolutely. It's the crucial why we need to answer first. Each pathway really does point towards a different strategy. For instance, an adrenal tumor often means surgery might be the best option, maybe even a cure if it's benign. Whereas those pituitary-dependent cases, the PDH ones, They're usually managed medically, often with lifelong medication.
Yeah.
And iatrogenic Cushing's. That requires a very specific gradual tapering off of the steroid medication. You can't just stop at cold turkey.
Right. Now, let's talk about what this actually looks like in a pet. You might be listening and wondering. The tricky part, as we said, is these signs creep up slowly, and they really do mimic normal aging. It's a master of disguise.
They absolutely are subtle, certainly at first. It's what we call an insidious onset, the most common symptoms. Well, first off, your pet starts drinking a lot more water.
Yeah.
Because they're drinking more, they need to pee much more often. We call that polydipsia and polyuria.
Always thirsty, basically.
Exactly. You might also notice an insatiable appetite, polyphagia. They just seem hungry all the time. And increased panting, even when they're not hot or haven't just exercised. That's a common one too. Hair loss is another big one. Often it's on the body, but it typically spares the head and limbs, which can give them a bit of a distinctive look. The skin itself can become noticeably thinner, almost fragile sometimes. And many pets develop that classic pot-bellied or distended abdomen.
Is that just weight gain, or is there more going on there?
It's usually more than just fat. It's often a combination of muscle weakness in the abdominal wall and an enlarged liver pushing things out. That gives that classic sort of sagging, pot-bellied appearance as one of those telltale signs. Beyond that, you might also see just general muscle weakness and lethargy. They just seem tired. Owners often report recurring skin infections, or maybe wounds just take longer to heal than they used to. And sometimes you might see a darkening or thickening of the skin itself, which we call hyperpigmentation. Even behavioral changes, like restlessness or unusual irritability, can sometimes be subtle indicators. Now, for cats, it's worth mentioning, feline hyperadrenocorticism is extremely rare, much, much rarer than in dogs. But when it does happen, cats show similar signs, but they tend to have more severe skin issues. Their skin can become incredibly fragile, like it can tear just from grooming or handling. And in cats, Cushing's is very often linked with concurrent diabetes mellitus. So if the cat has both, that's a big clue.
Okay, that's good to know about cats. And it's important to point out that this condition primarily affects middle-aged to older dogs, right? Usually over 6 years old. And are there specific breeds that owners should be more aware of?
Yes, generally over 6 is typical, and absolutely. Certain breeds seem to have a higher predisposition. We see it more often in miniature poodles, dachshunds, Boston Terriers, boxers, beagles, Yorkshire Terriers, and even Staffordshire Bull Terriers seem to be a bit more prone to it.
Okay, so with such varied signs, and many of them being so subtle and easily dismissed, this raises a huge question. How do veterinarians actually pin this down? How do they conclusively diagnose Cushing's and, importantly, differentiate it from other conditions that might look similar, like, say, diabetes or maybe liver disease? It sounds like a real diagnostic puzzle.
It really can be. You described it well. It's like detective work. We have to rule out other culprits. The diagnostic journey often starts with some key screening tests, things your vet can run pretty quickly, like a basic blood count, a CBC, and a urinalysis. These can show us the first sort of telltale signs, hint that something hormonal might be off.
Like warning flags.
It's exactly, like little red flags. On that CBC, we might see what's called a stress leukogram.
Yeah.
Think of it like your pet's body waving a little white flag. It's an imbalance in their white blood cells. Specifically, you get an increase in neutrophils, those are the first responders, and a decrease in lymphocytes, which are key for immunity. It's a pretty common pattern when cortisol levels are consistently high. Then, a standard blood chemistry panel might reveal elevated liver enzymes, especially one called alkaline phosphatase, or ALP. That's a really common marker in Cushing's logs. Elevated cholesterol is common too. And the urinalysis. Well, that will typically show dilute urine. Low specific gravity is the term. It basically means the kidneys aren't concentrating urine properly, which fits perfectly with that increased thirst and urination we talked about. Now, none of these alone confirm Cushing's, but they are strong clues that push us in that direction.
Okay, so those are the initial red flags waving. What happens next? How do you move from just suspicion to a definite confirmation?
Right, that's when we bring in the more specific tests, the cortisol function tests. These are crucial for actually confirming the diagnosis. One common one is the ACTH stimulation test. This involves measuring cortisol levels before and then after an injection of synthetic ACTH. Dogs with Cushing's typically show a really exaggerated response. Their adrenal glands basically overreact to the signal. This test is also really useful for diagnosing that iatrogenic Cushing's, the medication-induced kind. It helps show if the body's own adrenal system has been suppressed by the external steroids. Another key test, maybe even more common for initial diagnosis, is the low-dose dexamethasone suppression test, or LDDS. Here, we give a small dose of dexamethasone, which is a synthetic steroid, and measure cortisol levels over several hours. In a healthy animal, this tiny dose should tell the pituitary to stop signaling for cortisol, so levels drop. Makes sense. But in dogs with Cushing's, their body fails to suppress that cortisol production properly. Levels stay high. That confirms the overproduction. If we need to dig deeper, maybe to figure out which type it is, pituitary or adrenal induced, we might use a high-dose dexamethasone suppression test. Or measure the endogenous ACTH level in the blood. That helps differentiate, because ACTH will be high in pituitary cases but low if there's an adrenal tumor pumping out cortisol on its own. And beyond blood tests, imaging plays a really vital role too. An abdominal ultrasound is super helpful. It lets us actually look at the adrenal glands. We can see if they're both enlarged, which suggests pituitary disease, or if there's a tumor on just one gland pointing towards adrenal disease. And for getting a really good look at the pituitary gland itself, especially if we suspect a larger tumor there, an MRI or CT scan is the best. Those are more involved and costly, so they aren't always the first step. So yes, it's definitely a careful multi-step process, ruling things out, gathering clues, and finally zeroing in.
Okay, so once you've gone through all that detective work and the diagnosis is confirmed, what does this all mean for a pet owner? You mentioned the treatment approach isn't one size fits all. It really depends on the type of Cushing's and the pet's overall health, right? Back to those different causes.
Exactly. That's a critical point. Knowing the cause dictates the treatment. For most of those pituitary-dependent cases, the PDH ones, we usually rely on medical management. The most commonly prescribed drug nowadays is Trilostane. You might know the brand name Adrenal. It works by inhibiting a specific enzyme that's involved in making cortisol. So it effectively reduces how much cortisol the body produces. It's an oral medication, usually given once or twice a day. But, and this is important, it requires really regular monitoring. Blood tests for electrolytes and cortisol levels are essential. We need to make sure we're hitting the right dose, not too high, not too low, and watch for side effects like vomiting, diarrhea, or lethargy. Then there's an older drug, midotane, sometimes called Lysodren. It's a bit more, aggressive. It's actually a type of chemotherapy agent that selectively destroys some of the cortisol-producing cells in the adrenal cortex.
Oh, wow.
Yeah, it's very effective, but it requires extremely precise dosing and very careful monitoring. Because if you give too much, you can actually destroy too much of the adrenal gland and flip the problem completely, causing Addison's disease. That's hypoadrenocorticism, where the body makes too little cortisol.
Right.
And that has its own set of serious risks. So midotane needs a lot of respect and careful handling. There are a couple of other drugs like ketoconazole or eldeprionol that have been used, but honestly, their efficacy is often limited, so they're much less common choices now. Now, surgical treatment is another major option, especially for the adrenal-dependent type, the ADH. An adrenalectomy, that's the surgical removal of the affected adrenal gland, can potentially offer a cure, especially if the tumor is benign.
A cure? That sounds promising.
It can be, but it's major surgery. It carries significant risks, particularly in older pets who might have other health issues. It requires a skilled surgical team and very intensive post-operative care and management. There's also hypophysectomy, which is removing the pituitary tumor itself. That's more common in human medicine. It's technically possible in pets, but it's rarely performed due to the complexity and availability of specialized centers. And finally, for that iatrogenic Cushing's, the one caused by steroid medications, the treatment is completely different. It involves very carefully and gradually tapering off the corticosteroid drug that caused the problem. This allows the pet's own adrenal glands, which have likely shrunk from lack of use, to slowly wake up and resume normal function. And I have to stress, you can never abruptly stop long-term steroids.
Right. You mentioned that could be dangerous.
Extremely dangerous. It can lead to an adrenal crisis, which is a life-threatening emergency. So tapering must always be done under strict veterinary supervision.
Okay, so lots of options, but it sounds like regardless of the path, this is often a long-term commitment. It's important for you, the listener, to know that Cushing's is typically a chronic disease. It requires lifelong management. It's not usually something we cure outright, especially the pituitary form, but something we manage together with your vet.
That's absolutely right. It is a journey. But the good news is, with early diagnosis and proper treatment, most dogs with Cushing's disease can live comfortably for several years. Their quality of life can be significantly improved. Generally speaking, those pituitary-dependent cases tend to have a better long-term prognosis than cases caused by adrenal tumors, especially if that adrenal tumor turns out to be malignant, the cancerous type. But if Cushing's is left unmanaged, it can lead to some really serious secondary problems. We're talking about things like diabetes mellitus, pancreatitis, dangerously high blood pressure, hypertension, recurrent urinary tract infections, and even life-threatening blood clots, which we call thromboembolism. So that's why ongoing monitoring, regular checkups, blood work, sometimes urine tests, is absolutely essential. It's crucial for managing the disease effectively day to day and helping to prevent or catch these complications early.
That makes sense. So while we can't usually prevent Cushing's disease from developing, especially the pituitary or adrenal types, it sounds like early detection through regular veterinary checkups is really paramount for improving the outcome. It really comes down to being vigilant as an owner.
Indeed, vigilance is key. And for owners whose pets are on long-term corticosteroids for other conditions, it's vital that vets always aim to prescribe the lowest effective dose for the shortest possible duration. That significantly reduces the risk of causing that iatrogenic Cushing's. But mostly, yes, we encourage owners to be educated, know these common signs we've discussed, and be especially observant in their middle-aged and older pets. Don't just dismiss changes as getting old. And partnering with your vet for those regular checkups, maybe including routine screening blood work or urinalysis as they age, that really is the best tool we have for catching things early and monitoring how treatment is working. Your active participation is invaluable.
So, to kind of wrap up our deep dive today, Cushing's disease in pets. Yes, it's complex. Yes, it's chronic. But the core message seems to be that it is manageable with the right medical intervention and consistent, regular veterinary care. It's definitely not an automatic death sentence, but more like a journey of ongoing partnership between you and your vet team.
That's absolutely the take-home message. Modern diagnostics and treatments have truly made it possible for many, many pets with Cushing's to live long, happy, comfortable lives. The key really is that close communication and teamwork between pet owners, who know their pets best, and your veterinary team. That partnership is central to successful management.
So maybe a final thought for you to consider.
Given how easily some of these early signs of serious conditions like Cushing's can be mistaken for just normal aging, how might a deeper understanding of your pet's physiology, like we've discussed today, empower you to be an even better advocate for your beloved companion's health throughout their life?